We're live, Trev.
Trevor?
Good morning, everyone. My name is Trevor Schell, and I'd like to welcome you all to the final week of OHCOW's 2025 RSI Day webinar series. Today, February 28th, is actually the official day for RSI Day. RSI Day was founded 26 years ago by a group of injured workers led by Catherine Fennick, an Ontario resident, whose goal was to increase the awareness of musculoskeletal disorders to highlight the importance of prevention. Unfortunately, due to unforeseen circumstances like COVID-19, organized local events faded away. But OHCOW, primarily led by our ergonomists, have maintained the legacy of RSI Day, as today we bring to an end our 26th annual event. This year, we surpassed well over 1,800 unique registrants from 64 different countries. RSI Day has not only become OHCOW's Seminar webinar series, but also the world's largest ergonomic focused webinar. I would like to thank all of our loyal and dedicated supporters who've attended over the years, but also any of you joining us for the first time this year. I'd also like to thank my fellow OHCOW ergonomists for their ongoing contributions and commitment to not only RSI Day, but also all they do in their roles for OHCOW, from new tool development, presentations, prevention initiatives to reduce musculoskeletal disorders in partnership with workplace parties, and the important work of assisting injured workers to establish the work-relatedness of their denied WCB claims. I'd also like to thank Lisa Wilder, OHCOW's communication coordinator, for maintaining OHCOW's RSI Day webpage and dealing with all my last-minute changes I've thrown on her. Also to Tony Lee, OHCOW's IT coordinator, whose vital role behind the scenes managing our WebEx program and our Slido surveys. A big thanks there. Finally, to Valerie Wolf, the director of OHCOW's Ergonomists, for her ongoing support over the years and dedication, not only to RSI Day, but also all of our ergonomic initiatives, of which one has led to a very special announcement I'll be making later on in our session today. Now, if you have not yet downloaded the handouts for today's session, as well as a link to our QEC calculator, they are available on OHCOW's RSI Day webpage. So I do recommend, especially for the second session for the QEC calculator, you do take an opportunity to download the calculator itself. You will also notice a survey that will be appearing on your screen throughout the webinar. It's imperative that you take the time to complete it to allow us to justify to our funder the impact and importance of holding such a webinar series. There'll be a pre-survey that's available right now and a post-survey that will pop up near the end of the second session. The chat is going to be monitored by my colleague, Andrew Flanagan. So any questions you have for the presenters, we ask that you please post them there. Now today, we're going to be having two sessions brought to you. The first being visual ergonomics, the relationship between vision and office ergonomics, and also a review and the release of the quick exposure check workplace assessment calculator that's been reconceptualized by us to make it much more user-friendly. Now, with that being said, we're going to get our first presenter ready. So as I mentioned, the session is entitled Visual Ergonomics, the relationship between vision and office ergonomics, and it's presented by OHCOW Ergonomist Dwayne Fuchs and Optometrist Dr. Joe Valente. Dwayne, are you set to go?
Yep. I just gotta see if I can reshare. Am I sharing again, Trev?
Yes, you are. You just need to go into presentation mode.
Okay, we good?
You are great.
Okay, thank you so much, Trevor. I just want to add one more thank you to all of the thank yous that Trevor provided. Trevor's the one that makes this whole thing go. He has for number one from the beginning, and he makes it go every single year. So the biggest thanks should go out to Trevor for all of his efforts, ongoing efforts with organizing and providing everything regarding RSI Day. So the rest of us only take on a very, very small little role compared to all of the time and effort that Trevor puts in each and every year. So he's the one that needs the kudos for this. So thanks, Trevor. So as Trevor mentioned, myself, along with Dr. Joe Valente, an optometrist here in Thunder Bay, we're going to speak on vision and office ergonomics and how they're related to each other and how they impact each other. So I'm just going to go through a little bit of background information, and then I'm going to hand it off to Dr. Valente to speak on the eye and some eye conditions. Get to eye corrections as well, and then we'll come back to some ergonomic changes related to what we would be doing with corrected vision. So again, most people that are attending these already knows, what our definition of ergonomics is. Working smarter, not harder. Basically, we attempt to design things and fit the job to the worker as opposed to fitting the worker to the job. So the there is a definition for visual ergonomics that was put out in 2013 by what's termed as a Visual Ergonomics Technical Committee. It's a bit of a tongue twister. Visual ergonomics, multidisciplinary science concerned with understanding human visual processes and the interactions between humans and elements of the system. It applies theories, knowledge, and methods to the design and assessment of the systems, optimizing human well-being and overall system performance. It's a bit of a long, hold on here, I'm kind of locked up here, just a second here. Oh, hold on here. Just one sec, Trev, I'm locked up here for some reason.
We still see the slide. There you go.
Oh, yeah, there you go. I just couldn't move it. All right. Visual ergonomics, basically it relates to everything. The nature has made our visual system so dominant that we vary our body positions based on our visual system. Okay, our postures are varied based on how we can see, and any deficiencies in our ability to see changes how our body positions. We use our vision, for those of us that are lucky enough to be able to see correctly, for everything: reading, commuting, leisure, entertainment, manual work tasks, electronics for both home work and school. So it's a fairly large topic that would take a number of presentations to really go through. So that's why today we're just basically going through, we're just basically going to hit on office ergonomics and how vision is involved with it. So why are we just doing that? Well, because we live in an electronic age for sure. Okay, our visual habits are changing. As time goes on, we're using more and more technology. The COVID-19 pandemic definitely did not help, made it worse. Those professions that maybe only utilize technology sparingly now utilizes technology an awful lot. Our lifestyles have changed overall. We embark upon far less activity now than we ever did before. In general, most people spend a minimum of 7 hours per day on a screen. And that's a very, very low minimum. So main ergonomic risk factors in the office, there are plenty. We're not going to go through a lot of those. If you have any, or you want to obtain any more knowledge on those, you can go on our website and look at our office ergonomics reference guide. But today's presentation, we're basically going to be looking at how vision affects awkward postures in the workplace, okay? Body positions that deviate from neutral. So awkward posture is basically anything that deviates from neutral posture, right? In general, neutral posture, like the illustration shows on the right, from a standing position is basically standing upright in the anatomical position. From a seated position, your joint angles are generally 90 degrees or 180. So any awkward postures can lead to asymmetrical loading, can lead to impingement and stress upon the body structures. So correct working posture, these two illustrations, one on the left shows the general correct sitting posture, the one on the right, the general correct standing posture. And again, as mentioned, we're looking at 90 degrees of the ankles, knees, and hips, around 90 degrees of the elbows, 180 of the wrists, 180 of the shoulders, and then a neutral position for the head and neck. The upper body angles are very similar for standing position as they are for seated position. And the reason I'm going through this is improper ergonomics and poor vision can lead to poor posture. So good vision, being able to see what it is you're looking at, hopefully aids in keeping an individual in correct posture, okay? If the vision is compromised, a person will ultimately adopt a posture to ease the strain on the visual system. Okay, so if you can't see something, what do? You lean in. You lean in or you bring it towards your face. Some method or some part of your posture tends to change based upon that, okay? So we need a good visual environment to have a good good working posture. Poor vision equals some sort of compensation, which potentially leads to musculoskeletal disorders of the neck, the trapezius, the upper back, shoulders, arms, and lower back. Okay, the two illustrations demonstrates that, right? So the individual on the right, they can't quite see that monitor because it's too low. So what do? They bend their knee, or they bend their neck towards the monitor. Okay, so now we've been here for about 15 minutes. I want everybody to have a position change. If you're sitting, stand up. If you're standing, sit. Lift your arms up in the air, move around slightly while we're continuing on with the presentation. Also, I want everybody to embark upon an eye break. Traditionally, we touted the 20-20-20 rule. Now we're adding a fourth 20 to that. So basically, approximately every 20 minutes, look away approximately 20 feet away for about 20 seconds. The fourth 20 that's now recommended by eye care professionals is to blink. So you can blink 20 times, doesn't necessarily matter how many additional blinks. But when we sit and look at a device, we tend to blink less. We tend to stare more. Our eyes tend to dry out. So when we're looking at a position in eye break, we're now looking at 20, 20, 20, 20. Blink your eyes as many times as possible. We're going to go through this break several times throughout this presentation. So some things we need to consider. So the chair, okay. Why are we talking about the chair? Well, again, the chair needs to be ergonomic and it needs to sit or fit the individual so it can be adjusted so they can meet those joint angles, okay? The joint angles, again, of 90 degrees or 180. Not going to spend a ton of time on the chair, but if you don't see properly, if we go back to those other illustrations that we had, if you cannot see what you're doing, you will deviate from sitting in a correct position. So obviously the things people want to be talking about with vision and office ergonomics are your computer screen and the monitors, right? The key is to be able to view the information correctly and easily. Okay, the size of your monitor should be based on your tasks, the average time you're using them, and the distance from which you are away from the monitors. And you're going to see, as we progress through the presentation, the size also is dependent upon how well you see and or if you need corrected lenses to help correct your vision. Okay, they should have separate controls, should be height adjustable. The number of monitors, it's really important to look at the number of monitors if you really require them based on your tasks. Okay, so again, some quick visual office ergonomics tips here. We generally see horizontal and approximately 30 degrees down. So it's important to make sure that you know that when you're setting up your monitors so that you have the height of the monitor and the viewing angle correct. Okay, we want to have your monitors generally set so that when your eye strikes the monitor, your eye is striking the top of the visual area. Okay, the area in which you're generally going to be looking at your monitor. So for instance, if you're looking at a document where you're starting to see the print and the paragraphs and the wording on the document itself, that's important. Okay, the viewing distance is also important. Okay, it's important to make sure that you can see the monitor correctly, but that the monitor is not too close because your eyes work harder in order to see closer. So in general, we recommend the monitor distance should be about arm's length away. But it's important to remember that that's a general recommendation. What's important is that the individual can see what they're working on in neutral posture without extra strain or work on their eyes. Okay, multiple monitors, as I mentioned, you need to decide whether you actually really require multiple monitors. If you do, they should be set up accordingly. If you're using them equally, then you should be basically bisecting where it is that they're meeting, the middle illustration there. If you're using one primarily, that should be treated as your primary monitor, with the other one basically off to the side. If for some strange reason you actually require 3 monitors, you should be sitting directly in front of the middle monitor and utilizing your monitors accordingly, meaning the middle monitor should have 40 to 50% of use versus whatever it is that you're using on the left and right monitors. Document supports, same thing. If you're utilizing documents, reading documents, doing those types of things, then you need to make sure that you have document supports to try to keep those documents in line with your monitor and or monitors so that you're in line of the same visual plane. Keyboard, we're not going to go through a ton of the keyboard, but it's important when you're looking at vision. And I highlighted keyboarding proficiency here because those of us, yes, I'm one of those, that are a search and peck typist where you have to look down in order to find the letters. Vision, corrected vision, or uncorrected vision will make a huge difference in how you see both the monitor and that keyboard. Okay, so it's important to know and be honest about what your keyboarding proficiency is, especially when we get to the area that Dr. Valente is going to speak about in terms of correcting some of those potential eye issues that we have. Again, technology, I'm going to throw that back out there again. We're using technology way more than we ever did before. Laptops, mobile phones, tablets, those types of things. So keep in mind, they're not intended to be used for long durations, okay? They're intended to be used mobile when you're moving around doing those types of things, okay? So if you are using those, you should be using some sort of external equipment so you can set those things up properly for use, okay? We're going to touch a little bit on lighting, not a lot. We're not going to spend a ton of time on lighting. Again, like the risk factors and some other things, and those of you that, you know, are familiar with ergonomics and office ergonomics, we could have a 2-3 hour long presentation or several different presentations on lighting itself. Okay. So proper lighting is essential, obviously, for visual comfort and to avoid eye issues. It's also individual to the person's vision, what their tasks are as well. Okay. It's important to remember that with the lighting because we need different lighting based on different tasks. If we're performing different tasks, both paperwork tasks and computer-based tasks, we might need to look at the differences of what we're looking at for the lighting while we're using the computer and the lighting while we're using the paperwork, okay? It's important to think of natural light, which is best, provided that it doesn't create glare or shadows. The available artificial lighting, the colors, the finishes, and the patterns on things like the ceilings, the walls, and the other surfaces, your desk, even things that you have hanging from your walls, the way that your frames potentially reflect or don't reflect the light, okay? Soft colors are generally better, meaning not black or white. Matte finishes versus gloss finishes, you tend to have less glare as well. It's also important that what is behind your monitor and behind where it is that you view the most is not cluttered. What I mean by cluttered is it doesn't have a lot of patterns and those types of things because your eye tends to focus on those, and it takes more work for your eye to focus on that and move back and forth to what you're doing. So you don't want those types of things directly within your normal field of vision. Okay, window coverings, blinds, curtains, those types of things are also important to look at, as well as the direction of light and glare. Okay, not going to go through a ton of glare. Basically, reduce glare by positioning your workstation so that you don't necessarily get as much glare. Perpendicular to windows, if you can use blinds or curtains to dim it, you need to look at your lighting filters, those types of things as well. Okay, very important to look at those things. Okay, so now we are going to take another quick position break and an eye break. Remember 20, 20, 20, 20, and I'm going to hand it off to Dr. Valente, who was kind enough to help me with this presentation. So just give us one moment to switch over and away we go.
Good morning, everybody. Everybody hear me okay?
Yes, you're fine.
Perfect, thanks. So I'm just going to continue on from where Dwayne started the presentation here, and we're going to focus primarily on the eye, how the eye works, and how we provide correction in order to try to improve the ergonomics when people are at their workstation. So just initially and quickly here, how the eye works. The light enters through the cornea, that's the front surface of our eye. It passes through the iris, that's the colored part of our eye, and that iris then will constrict or constrict or dilate depending on how much light is coming in order to try to get that light to focus on the back of the eye, the retina, as clearly as possible. The lens, which is the next part the light will go through, will change its shape once again to try to get that light to focus on the retina accurately. Once that light hits the retina, the photoreceptors of the retina will change that to electrical signals, which then get passed to the optic nerve, and that optic nerve will carry it to the brain in order for that image and that light to be processed. So that whole system has two key components in order for us to see what we're looking at clearly. That light needs to focus on the retina accurately, so that signal that gets transferred to the optic nerve is a clear signal. And then the pathway from the optic nerve all the way back to the brain must also have developed properly. And most of that development happens as we're young. Actually, the studies will kind of say that all that development happens before the age of 8. After the age of 8, there's not really a lot we can do with that pathway. But those two things work together in order for us to see clearly. One main thing we're going to be focusing on a lot here is what happens to the eye as it ages and the correction that is needed in order for us to see clearly. From birth to approximately mid-40s, the lens inside our eye is able to change shape in order to focus on up close images. So we're looking at the distance, our eyes are at complete rest, we see everything well. We bring something up closer in order to see it, and our lens will change shape in order to focus that on our retina. What happens as we age is that lens that's inside our eye is unable to change its shape in order to change our focus. So the light will come in, we're trying to see something up close, the lens goes to change the shape and it's just not able to do so anymore. And that's when oftentimes the whole need for reading glasses tends to come into effect, right? So it was historically thought that it was the muscles of the eye that prevented the lens from changing its shape, but it's now been learned that that's actually not the case. It's the lens itself which becomes larger and less elastic and actually is unable to change its shape in order to focus that light onto the retina accurately. So all of these problems and a lot of what Dwayne was talking about as well can lead to this condition called digital eye strain or computer vision syndrome. So essentially this condition affects at least over 60% of computer users. I would say it's actually the majority of computer users will get some of these symptoms at some point during their work life. And this condition is a group of symptoms: eye discomfort, eye pain, dry, red eyes, blurred vision, headaches, a whole group of symptoms that composes the computer vision syndrome, all related to excess time on the computers. Dwayne talked about already at how most of us spend up to 7 hours, if not more, hours on the computer. And that risk factor for computer vision syndrome is once we hit that 4-hour mark, we're all at risk of experiencing some of these symptoms. Lighting, glare, a dry environment, which is a big one for us in the winter, whether the furnaces are running, fireplaces are on, the heaters in your car, all of that will contribute to some of these conditions. So one main issue here, and where I'm going to focus on a bit, is the actual correction needed in order to be able to see. So if someone is not seeing their monitor or seeing their work well, then that is just going to exacerbate or make their symptoms worse, because they're having to strain, they're having to attempt to focus, move closer, move further away in order to try and see it, right? So we're going to talk about a lot of the options and the way we try to mitigate that part of it in order to get the person seeing as clearly as they possibly can. Dwayne touched on this, and this is an extremely important part, and I'm just going to throw out a statistic on this. A lot of computer vision syndrome and eye strain issues occur because when we're looking at electronic devices, our blink rate goes way down. So as it says here, we usually blink about 15 to 20 times a minute. When we're on digital devices, now that's a computer screen, that's a laptop, that's a cell phone, iPad, it doesn't matter. Our blink rate goes down to less than 5. So without even realizing, we're sitting and we're staring and we're staring and we're staring, which can obviously then just leading to a whole host of symptoms that contribute a lot to the whole computer vision syndrome issue. One thing I wanted to touch on here, because this is something you guys may hear a lot about, and I know on a daily basis I get asked about this, is the whole issue about blue light and the blue light that's being emitted from our electronic devices. There's no doubt. So first off, actually, let's look at that, just define what blue light is. So you can see at the bottom here, the colors of the rainbow, or the old Roy G. Biv that you guys may have been taught, right? And the different wavelengths that correspond with each color. So the blue light that we're talking about is on the left side of that image, where it's the lower end of the wavelength. So that wavelength is what's being emitted out of these electronic devices. It was thought initially that that wavelength was damaging to the eye. It thought that it contributed to the computer vision syndrome. It actually also was thought it was causing issues with our retina in behind the eye. It has since been proven that it actually really doesn't seem to be the case. It has been shown that it does affect our sleep and our circadian rhythm. So if you are spending a lot of time on your phone or on your iPad right before you go to bed, your sleep may be affected by that. But as far as the actual vision component of it, it's really been shown that it's not a huge issue. On top of that, when I talk about some glasses here and some options, there are coatings that can be put on top of glasses to block this blue light out. But even the best coatings are only able to filter out about 30% of that blue light at that wavelength. So you're still getting 70% passing through. So I mean, it really at this point for us in our industry here, we don't consider it a whole lot. If I do have patients who really want to have it, by all means, go ahead. It's definitely not causing any harm, but I'll just tell them that there's no guarantee that it's necessarily going to help anything either. So a few things we can do to try and manage some eye strain and the computer vision syndrome. The setup of your monitor and your entire desk situation obviously plays a huge role, right? Dwayne talked a lot about that, and all of that plays a huge component of it. Some of that will also connect back to the vision correction that we use, which we'll get into here in just a sec. Just trying to decrease the overall screen time in general is a great thing. I know that's a lot easier said than done for people, but when we talk about 4 to 7 hours every day, that's going to be hard on us no matter what, right? And we also already talked about the 20-20-20-20 rule. I can't emphasize this enough. I know it sounds like a relatively simple thing, but it really and truly can make a huge difference to people. For some people, that 20 blinks may not be enough, or if they don't get to doing this as often as they should, they are able to add some lubricating drops or some artificial tears. I recommend this quite regularly. Just one drop at a time, whenever they feel like they might need it. And oftentimes that's enough to really help with some of the symptoms that they're experiencing. So this is just a bit of a summary slide here, just about how the normal vision works. I did talk about this a little bit, and I'm going to use this then to expand on some of the other visual conditions that we see on a daily basis, which affect both their vision correction as well as their setup as far as their monitors and screen goes. We talked about how the light enters the eye, goes through the cornea, through the pupil, through the lens, and then gets refracted, which means that light is changing its shape or being bent in order to land on the back of the retina correctly. The reason that I'm bringing up the whole refraction just quickly is that the amount of power that is needed in a vision correction to attempt to try and focus that light back on the retina is measured in diopters. So where that comes into play is, let's say somebody is using just an off-the-shelf, over-the-counter reader, and it says a +2 is the number that it has on it. You may read into that a fair amount. That +2 is actually referring to that power of the lens measured in diopters. So what that means is that it's a +2 diopter lens in order to focus that light back on the back of the retina accurately. So just to briefly touch on a few common conditions here, just so in case you guys hear any of these terms or you run across patients or people you're helping discuss some of this with you. Hyperopia or farsightedness, essentially what that one means is that the eye is too short. So when the eye is too short, that light will enter the eye, get refracted or bent, but it misses the retina. It actually is landing behind the retina because the eye is too small, as you can see just on that bottom image there. So for the most part, this is going to produce blurry images, especially blurry images at near. And when we're younger, the lens that's inside our eye will attempt to change shape in order to bring that focus point back to the retina. When that lens, though, just isn't capable of focusing enough, that's where the need for prescription glasses comes in to try to bring that focus point back to where it needs to be. Myopia or nearsightedness, by far the most common visual issue, by far. This one normally presents somewhere in your early teens, 12, 13, 14. It can present at any time, but by far that's the most common time. And essentially, this is a condition where your eye is too long. So the opposite of what we just discussed with hyperopia, with myopia, with the eye being too long, the light will actually focus in front of the retina, once again producing a blurry image. The difference here, though, is this is where the image is blurry at the distance. So people will need glasses in order to take that light and focus it back on the retina correctly again when they're looking at distance objects. Generally, when they take their glasses off, they can actually see up close quite well. Their focal point of their eye with nearsighted people is actually up close, so they can see really well up close without any issues really at all. So astigmatism, this is a big word that most of my patients have a hard time even pronouncing correctly and have even less of a time really knowing what it means. Essentially, it's just a big word to say that your eye is shaped more like an egg or like a football rather than like a perfect circle. So if your eye is shaped like an egg, when that light enters, it doesn't focus on a single point, it actually focuses on 2 points. And those 2 points can be anywhere in relation to the retina, in front, behind. But what we do then with our vision correction is that we'll take both of those points and get them to focus on the retina correctly again. This is the big one, I think, when it comes to setting things up properly, and the options in order to get people to see better is presbyopia. So presbyopia is essentially the condition that occurs somewhere in our early to mid 40s where we lose that ability to focus on up close objects. The term itself actually comes from a Greek word meaning old eye. So essentially, back in the day, I guess our eyes were old when we were 45 and we were unable to focus that image on the retina correctly when we were looking at up close objects. So we then use glasses, obviously, just as with the other conditions, to bring that focus back onto the retina. Let's use this time, guys, just to do another break here. Stand up, move around, get a drink, blink your eyes a few times, and all right, perfect. So we're going to talk about some of the corrections now we can use with glasses in order to try to help some of these conditions. The main one being how we are then helping the person to see their monitor, and then how this will influence their monitor positioning, and all their whole office setup here in general, right? So the one key takeaway here, Dwayne talked about glare and lighting a little bit. Any vision correction really to perform its best in an office setting, or quite frankly in any setting, should have some anti-glare or anti-reflective coating on it. It just helps to mitigate some of the glare that's coming, whether it be from the lights, from the monitors, from anywhere really. So I touched upon the whole single vision lenses, or the reading glasses. What makes reading glasses difficult for this is that they are set up to be clear at one specific distance. So whatever that distance is, whether it's 40 centimeters, 60 centimeters, 90 centimeters, that's the only distance where things will be clear. So if you have your monitor set up at the distance for you to see clearly with your reading glasses, if you go to look at something up close, whether it be your phone, whether it be a document, you are not going to be able to see it very well. And then once again, you're going to have to change your posture in order to try to see that. And vice versa. If it's set up in order to see something up close, when you go to look at your monitor, you're not going to be able to see it very clearly again, and you're going to have to lean forward and again, poor posture will result, right? The bifocal or the trifocal, these are, what people used to use all the time. They're the ones that have that distinct line in them. When it comes to the bifocal, what makes that challenging here, and I'll show this image here now, is that there is no image or no part of that lens that is actually for the computer or the intermediate distance. You have the top part is for your distance and you have your bottom part is for your near, but the computer tends to sit in that in-between distance, which that lens has no way of correcting whatsoever. So then once again, you end up looking a lot like this guy here with your head tilting back to try to look through that near portion. And frankly, he probably isn't even close enough to his monitor, so he would be leaning in and tilting his neck in order to see it. Once again, not the best, right? The trifocal is better. What makes it better is that there is a part of the lens in there that is for that intermediate or that computer distance. The issue there, though, is that part is still very small. You can see it's just this little ribbon. So again, you find yourself oftentimes having to tilt your neck or just get everything lined up in that one location. And that area might not even be big enough to cover your entire monitor. In fact, it probably isn't. So then you still end up having to do a lot of bobblehead and a lot of moving in order to have things clearly that you're trying to see. The progressive or the blended bifocal, the no line bifocal, there's a lot of terms you'll hear for this one, is by far the most common option out there. Most people will gravitate to this lens because it's a little bit of a jack of all trades here. It's similar to a trifocal. The difference being, though, is that those areas are blended in rather than being distinct zones or distinct lines on the glasses. They actually have an even smaller area, though, for the computer. You can see in this image here that intermediate zone is very small. Not only is it short vertically, but it's also short horizontally because the sides of any progressive lens are actually blurry. So you may be looking at your monitor and the dead center of the monitor will be clear, but anything off to the sides probably isn't. So then you end up doing a lot of neck turn, bobblehead, all this coming in, coming out in order to try to get this, see clearly with these lenses. The best option, and what I push pretty hard here with my patients or suggest to them to get at least, it would be a computer or an office lens. They are a form of a progressive in the sense that they have a distance, an intermediate or computer distance, and a reading portion, but the majority of the lens is for that computer or that intermediate distance. So now, rather than hunting and searching and just trying to find this little area of the lens to look through, you can actually maintain proper posture and see the entire monitor clearly because the majority of the lens is for that distance. And what's also super nice is if you are a search and pet keyboard artist here like Dwayne, it actually has a little bit of an addition here at the bottom in order for you to see your keyboard as well. So again, you're able to maintain posture better. What's also great about these is that there are multiple different options depending on the needs of the person. These are some lenses that my office uses, and you can just see they're all a computer lens, but they're designed differently. So the one on the bottom right has a little bit less area for the computer, but it also still maintains some distance. This is actually quite a common one because some people don't like to lose all of their distance. So when someone walks into their office, they don't like it that they're super blurry, so they actually prefer that. But if you have somebody who is wanting to have a large intermediate zone and is okay with the distance being blurry or whatever that combination may be, we have a lot of options in order to try to provide the best options for the individual and what their needs are, which then ends up helping you when you're designing their workstations and helping them with that part of it. All of these things will work together to try to provide them the clearest image and maintain the best posture as they can, right? So time for another break, everybody. We're going to switch it back over to Dwayne here, and he's going to talk a little bit about how some of those options with the vision and the lens options relate back to how we set everything up.
Okay. Thank you so much, Dr. Valente. That was spectacular. Fabulous information that I'm sure a lot of us wish we would have known before. One quick thing before I get into this, if everybody's wondering why we're keep doing these breaks, because they're important. They're extremely, extremely, extremely important. They're not only important for your eyes and vision, they're important for all ergonomics. Take these breaks. They don't take time. They don't take a lot of time, right? You can continue on to do whatever it is you're doing while you're still taking these breaks. They don't take a lot of time. So anyways, I'm just going to go through and explain a little bit of some of the ergonomic changes that you potentially should be looking at with the corrective lenses. So the first one that Dr. Valente spoke about, the single vision near lenses. If those are the lenses that you happen to have, and oh, by the way, the only way that you're going to know what the kind of lenses you have, ask your eye care professional who's prescribing these lenses to you. Speak to them, talk to them, tell them that you're what your job is, what you do, how much time you spend doing those things, that type of thing. So with these types of lenses, the monitor distance must be equivalent to your prescription. So you need to know where that prescription is set so that your monitor distance is there. You can have an ergonomist come and say, you know, this is the general distance, those types of things. You need to make sure that it's set in the proper position. You also need to be hopefully somewhat proficient at keyboarding, okay, unlike myself, so that you do not need to look down at the keyboard or you don't need to look around, okay? Because these lenses, you're not going to be able to see the keyboard as well or properly without moving your posture, right? The work tasks must be considered computer versus paperwork. Same thing. You need to be looking at how much change it is that you have in terms of what it is that you're looking at, okay? If these are the types of lenses that you do have and you work at a computer a lot, you may want to consider a different type of lens for your computer work. Bifocals, trifocals. Dr. Valente spoke on these and provided some of this information already, but the monitor must be set at the exact height, okay, in order to hold your neck in a neutral posture. So honestly, the easiest way to do that is you don't need measurements. You don't need those types of things. Set yourself up at your desk so that all of your other ergonomics are sound. You know, your chair is set correctly, your keyboard height is set correctly, those types of things. And then view your monitor. And when you're viewing your monitor, whether you have bifocals or trifocals, adjust the height of your monitor accordingly so that you're staying in that neutral neck posture, right? The photo that was on one of the slides that Dr. Valente was speaking to earlier with the individual leaning way back in their chair, that's because in the illustration on the right, because we see down in that range, right? So it's pretty important to be looking at that height. But again, don't look at exact measurement, exact numbers. Look at what it is that you are actually looking at. Okay, you also need to keep in mind that there's a limited viewing range here, right? So you need to organize the information on your screen accordingly, okay? You may not be able to utilize the whole entire monitor screen to view because that may still cause you to have to tilt your head, move your head, do, I guess the term that Dr. Valente used was bobblehead, to move around in order to see, right? With a bifocal, you tend to have a little bit larger range. With a trifocal, it's a little bit smaller, right? So keep those things in mind. The progressives, the PALs, again, the monitor must be set at the exact height. Okay, there's a pattern here, by the way. It needs to be set at the exact height. It's similar to the trifocals. Dr. Valente brought this up as well, but it's not usually as low as a bifocal, but lower than usual, okay? It also has a limited viewing range, okay? If you're using these types of lenses, you need to take into account the size of your monitor because that viewing range is smaller left to right as well as vertically. So if you're using a very large monitor or you're attempting to use two monitors, it's going to require more head movement, okay? It's going to require more left to right head movement. If you don't have the heights at the correct height, it's going to require more chin up, chin down movement as well. Okay. It may require you to move the monitor a little bit further away to increase the viewing area that you have. Okay. But again, you need to really take a look at how everything's set up. Key term, neutral neck posture again. The corrective lenses for the computer lenses, I believe Dr. Valente said that he recommends these the most. And there's a reason for that, right? Because they're easier to see. Okay, they're similar to the PALs, but the intermediate area is the most of the lens. Okay, has most of the lens with a smaller area to see the rest of the things. So you can actually see a greater portion of your monitor. Okay, with these, in general, you would set up your monitor as if you didn't require any corrective lenses. Our general ergonomic recommendations for monitor height so that your eyes are hitting the top of your viewing area, right? In general. But again, you set them up so that you are in neutral postures. Okay, there's less limitations in the viewing range. Okay, because the lens powers can be adjusted for the screen distance. Okay, same thing. It's important to know what your distances are, and it's important to communicate with your eye care professional. Okay, but the other key with this is that you really need to realize that you likely will require an additional set of glasses for other tasks. These lenses, they're called computer/office lenses because that's what they're for. If you're doing other things and you're integrating other tasks into your work, or you're walking as a break or anything else, you're going to probably require other lenses. That is very important to realize. Again, speaking with your healthcare professional on a regular basis and getting that information to them so that they can also provide that information back to you is super, super important. Okay. Yes, I realize you might need, 2-3 pairs of glasses, but in order to decrease some of these other issues, the eye strain, the potential postural issues, those types of things, this is something that you generally should be looking into for sure. So in summary, again, I tend to bring everything down to one slide. The eyes lead the body. For the most part, those of us that can see and can see relatively well with or without corrective lenses, our eyes lead our body. Poor vision equals poor posture equals MSD. Musculoskeletal disorders of the neck, trapezius, shoulders, upper back, lower back, wrists, everything's connected, people. Everything is connected. It's super important to look at that, okay? So, and I brought this up a couple times, maybe a couple dozen, get regular eye exams, okay, from your eye care professional. They're there to help you, and they're there so that you can speak with them and figure out a game plan together as to what is going to work for you, okay? Always, always set up your computer components to allow neutral postures, regardless of whether you have corrective lenses or you don't. 90 degrees, 180, eyes straight forward, neck in a neutral, neck and shoulder, or neck and head in a neutral posture. If you have some sort of lenses and you don't know what those lenses are, look at your computer components, set yourself up so that the rest of your ergonomics is correct. Have someone look at you. The easiest way is to have a friend or a coworker or a family member to look at you from the side. Maybe take a photo from the side so that you can see, you can tell what your level of eye level is and whether you're in correct or neutral postures. If you're taking photos, make sure you get down low enough. The person gets down so that they're taking photos at a parallel level so that you can see what's going on. Okay, very, very important. And evaluate your workstation on a regular basis. I am sure that Dr. Valente will concur on this. Your eyes change and they change sometimes rapidly, sometimes more gradually. If things seem to be changing, you might need to go and evaluate your vision a little bit more often than what you're accustomed to. But minimally, you can reevaluate your workstation on a regular basis to make sure that you're changing it. If things change, you can change it. It should be adjustable for a reason. And last point, probably the most important point, is change your position. Take your micro breaks every 20 minutes. 20 minutes, 20 feet, 20 seconds to refocus, blink, blink, and then blink some more. So that's what we have. I'm going to unplug the my microphone here so that we can hear all of the questions. And then I guess we'll open it up to questions. I do believe Andrew is going to be providing us with the questions there.
Yeah, thanks, Dwayne and Dr. Valente. We had a few questions come through. Can you hear me, Dwayne?
Yeah, I can hear you.
Okay, perfect. Thanks. Question number one, Taylor asked, is there a good at-home test to perform to help determine how far our monitor should be and whether or not we should increase the fonts or bring the monitor closer?
Well, yeah, basically, I think I nailed that in the summary slide. The at-home way of telling that is having somebody look at you, try to get yourself into those correct neutral postures. Have somebody try to look at you from the side, maybe take a photo so that you're in an upright position and you're in neutral posture. Then, once you're in neutral posture, keep adjusting your monitor. Adjust your monitor accordingly so that you can view it adequately for yourself, so that you can see everything that's on there, or as much of it as possible that you work with on a regular basis, so that you stay and remain in those positions. You can increase the fonts, you can increase the contrast, whatever makes it better for you as an individual so that you can see enough of the information on there so that you don't feel that your eyes are being overworked, and also so that you don't feel like you have to either lean into the monitor, lean back from the monitor, tilt your head up, or tilt your head down. Okay? Does that answer the question that you were asking there, Andrew?
Yes, I believe so. Thank you. People who are wondering, are computer lenses only used for computer work, and then after office work, would the individual need to switch their glasses to a progressive or alternative?
So yes, I would say the computer or the office lens is primarily designed for that task, which I know Dwayne alluded to a little bit. That does oftentimes mean you need more than one pair of glasses. I equate that a little bit to shoes. I mean, you can't have one pair of shoes that does everything for you either, right? So it's just in order to provide the best vision and to make your life just easier and your eyes feel better, you oftentimes do need a second pair. So I have many patients who will have their office or their computer glasses. They may even just leave them at their computer, or they leave them at work. And then they're there, they use them when they're doing that, and then they leave and they put their other glasses on, whatever those may be. But it does, in order to see your best, usually require at least two pairs of glasses.
Okay, thank you. There was another question regarding cataract lens replacement, and this may be a bit too in-depth, but does that have an impact on up-close vision and recommended corrective lens?
So yeah, yes, I know though. I mean, once you've had cataract surgery, that lens that they implant in your eye, essentially for everyone listening, cataract surgery means that the lens that's inside your eye was blurry or cloudy. So then they remove that lens and they replace it with a newer and a clear lens. That new lens that they put in, though, is not able to change its shape or change your focus at all, zero. So at that point, it's really no different than the presbyopic eye, which also is not able to change its shape in order to change our focus. So the correction options would be the same.
Thank you. What recommendations would you have for people who have monovision, either due to contact lens choices or an eye surgery, where one eye is now the close and the other eye is optimized for distance?
Well, that attempt depends a little bit on how it was all set up. Generally speaking, the goal of that is to try to keep people from needing glasses altogether. With, like you said, one eye is meant for the distance and one eye is meant for your up close, theory being that your brain will then be able to choose or use which eye depending on what you're doing, right? My personal experience with that is that most of the time it doesn't work that great. And I mean, some people are able to do it, but oftentimes their brain just isn't able to do that. So then, they end up needing some form of correction where both eyes can work together. Our eyes and our brains are designed for both eyes to work together, not to work independently of each other. So oftentimes they will end up needing some correction, if at very least for that computer distance, which can sit in the middle of what those two eyes were corrected to do. So, which would just come right back to talking with your optometrist, talking to the person that you're getting the glasses from, and trying to find the solution that'll work best for you.
I think we'll wrap it up there, but if there are any questions that we didn't get to, please just reach out to us by email and then we can get back to you. And with that, I think we'll move on to our next presentation.
Thank you, Andrew. I just want one more last time to thank Dr. Valente for his time to assist us in this presentation. His information was very, very valuable. Thank you.
That was great. Thank you, guys. Again, a great presentation by you both. So we're just going to take a second to switch over. We are going to be presenting on our QEC calculator tool that we have just recently revised. I am just going to post, while Melissa is bringing up our presentation, a link to the tool if you have not yet had a chance to download it. I just posted the link in the chat, so you should be able to have that. Melissa, whenever you're ready, we can begin.
Sorry, I'm just trying to get it on to the display mode here. Want to make sure everyone can see it. I'm going to take silence as a good thing.
Yeah, it looks good.
Okay, thanks, Val. Thank you, Trevor. So Trevor and I decided to tackle the quick exposure check, like he had mentioned in the intro here. This is something that has been on our website. It's not developed by us, but we took it and we have made it a few different times into easier formats to be able to compute. And so this is kind of what we decided to do again. So for those of you that don't know, the quick exposure check, or QEC, which you'll hear me refer to as, is an observational tool. It assesses the exposure to risk factors for work-related musculoskeletal disorders, and it can provide a starting point for intervention. So it can highlight, what exposures could be leading to higher scores at different body areas. According to the QEC reference guide, it's easy, it's a straightforward tool to use. It's going to provide different exposure scores for different areas of the body. It identifies needed exposure reduction, and it assists with job comparisons as well as before and after ergonomic interventions. Some strengths of the QEC include it's a rapid assessment of job tasks, it's a validated tool, it provides that before and after comparison of changes. So you can do it before any changes are implemented, then do it again, and then most likely you should see a reduction in that exposure score. It involves both the assessor and the worker evaluating the task. So you have both, you have the worker's involvement, which is huge into any type of assessment. And you can compare exposures between 2 or more people performing the task. So you have different anthropometrics. You could look at male, you could look at female, and you could see how their scores would differ. Some further strengths is that you can examine individual tasks or the entire job. So you can break it down and just, hone in on one task that you feel that might be contributing to injuries that have been identified by the workers or by supervisors, or you can look at the entire job. It really is up to you. You can kind of tailor it to your own needs. It does consider the back, shoulder, wrist and hand, and neck, and also looks at driving, vibration, work pace, and stress. Some weaknesses of it is it's not that user friendly. If anybody has ever used the original pen and paper version, there's these different kind of cubes that you have to align A1 to H2 and you're trying to figure out the score. So it kind of leaves that human error with these calculation, that potential to have that. And it can be long to complete, and you have this constant, like I need to refer back to the reference guide to see where, what is A? Am I looking at the back? Am I looking at the shoulder? Is it duration? So it just can leave a lot of, the potential for that human error, which is why we wanted to try to eliminate that with this calculator. The steps to using the QEC, like in any type of risk assessment, is that you want to establish your priorities. So in order to do that, you could look at WSIB claims, any requests from supervisors or workers. You could go back to your injury reports. If you see high injuries on certain jobs, maybe you want to take a closer look into that and use the QEC. You can look at the annual job reviews, even PDD reviews, or if there's any change to a work process, that might be a good time to go in there to hopefully, it's for an improvement, or you're just trying to see if there is any exposures there that puts people at risk for developing an MSD. Second, you want to inform workers about the process. Then you want to identify the job task. So, you could be talking to the worker for this or have the workers do the job and perform it, but you want to identify the tasks that you're going to be looking at and the actions that are performed in each task. So as far as like breaking it down even more. You want to define cycles, your frequency and the duration of the task, any breaks, and add any detailed information. So that would include any tools or equipment used, as well as weights, heights, any type of measurement that would be beneficial to obtaining. So there's, like I said before, there's the assessor, and there's workers that are involved in compiling the QEC. So the worker, you're going to have a set of scores for them, and then it also has the assessor's assessment, and it's combined. So you want to answer each question with respect to the task that you've selected, and you're always going to look at the worst case scenario for that body area. So if there is within one task that they're flexing their trunk, over 60 degrees, but then other parts of the task that are neutral, you're going to take account that 60 degrees because that's the worst case body position for the trunk. The observer may want to carry out some of the measures for any intervention that may be introduced by measuring weight of the load. Measures should be used to supplement the exposure assessment and not to replace the worker's assessment of the load. So the worker might have, their opinions are very important in this assessment because, again, you're taking into account both the assessor and the worker. You want to ask the worker to answer the worker assessment section. So ask the worker for more details if it's appropriate as a basis for identifying the nature of the problem and opening a dialogue to seek solutions. Any ergonomist on this webinar right now knows that workers are your best key source of information on how should we make this job better, because when they've been doing it day in and day out, they've had a lot of time to think about it, and they are the expert on the job. So always start by asking the worker. Then you're going to score the assessment, and the score of the assessment is going to point you in the direction of these exposure section and the breakdown of it. And you can determine any actions required based on these exposure scores, where you should basically start for any type of intervention. And then once interventions have been made, then you want to reassess after changes, because hopefully that's going to impact this exposure score. I'm now going to transfer over to Trevor, who's going to go over the observer and workers assessment portion of the QEC.
Great. Thanks a lot, Melissa. So if we can go to the next slide. Perfect. So there's a number of components to go into the QEC tool itself. And so we're going to go through each one just because it's important to know. The first one is, of course, what is the position of the back? What's your posture? The assessment for the back posture should be made when the back itself is most heavily loaded. So the worst case scenario is what you're looking at when you're looking at the posture of the spine. So for example, when you're lifting a box, the back is under the highest load when the person leans or reaches forward or bends down to pick up the load. And there's three posture classifications. Almost neutral, which means that less than 20 degrees of flexion, extension, twisting, or side bending. Moderately flexed or side bent, which is 20 to 60% or degrees. And then finally, excessively flexed or twisted or side bent, which is anything greater than 60 degrees. Now, probably the most complicated part of the QEC is this section, the back movement, what's known as B1 to B5, because there's basically two components to it. Is the back static or is the back moving? This becomes very important at the end when you're actually calculating the scores. So the question for that section is basically, is pushing, pulling, or carrying part of the task? In other words, is there movement of the spine? Okay. So if the answer is no, then the next question, is the back static most of the time? So if there is some slight movement, then you're going to select yes. If not, it's almost still majority of the time, you're going to select no. Whereas on the other side, if there is lifting, pushing, or carrying, dynamic movement, it then becomes down to classify the frequency of those tasks. So infrequent, less than 3 times per minute or less, frequent, 8 times per minute, or very frequent, more than 12 times. With respect to the shoulder, there's two components. The first being, what's the position? So again, it's based on the position of the hands when the shoulder and arms are most heavily loaded during work. And this may not be at the same time as when the exposure to the back is assessed. For example, the load in the shoulder may not be the highest level when the person bends down to pick up a box from the floor, but may actually be greater when the box is placed, say, up overhead on a high shelf. And again, the classifications are at or below waist height, at chest height, or at or below above shoulder height. Second shoulder part is arm movement. So is the shoulder actually moving? And again, the three classifications: infrequent, frequent, and very frequent or almost continuous. For the wrist and hand, it also begins looking at posture. And again, posture is assessed when the wrist is at its most awkward position. So this could be flexion, extension, side bending, or radial nonlinear deviation. If the wrist is almost straight, and if the movement is limited to a very small range, that's when you're going to select almost straight. If an obvious wrist angle can be observed during the task, then you're going to say it's going to be deviated or bent. With respect to movement, you're going to be looking at the wrist, forearm, and hand, excluding any movement of the fingers. So it's solely the hand and wrist movement itself. You're not paying attention to the fingers. And one motion is counted every time the same or similar motion pattern is repeated over a set time period, for example, 1 minute. So again, it's classified 10 times per minute or less, 11 to 20 times, or greater than 20 times. The neck, the posture is designed as excessively bent or twisted if the angle is greater than 20 degrees relative to the torso. The angle is exceeded, you're going to select either what's known as G2 or G3, which is yes occasionally or yes continuously. Otherwise, you'll be selecting no. That is pretty much neutral. Okay, and as Melissa mentioned during the introduction, the QEC itself is divided into two sections. So us as professionals being the assessor, and then getting the information from the worker. Because I mean, we all know no one knows the job better than someone doing it on a daily basis. So the first question we're going to ask the worker is, how much weight do you actually handle? And what's the maximum amount of weight? So this is the weight the worker would be lifting, but not the maximum weight handled in the task or the load handled to use the equipment. The worker's perception of the load weight may differ from the actual weight category. For example, a light load may seem heavier if your arms are fully outstretched and the moment arm of that load is further away from your body. The actual weight of the load can be measured by the observer for any intervention that may be introduced after the assessment's been done. This measure should be used to supplement the exposure assessment, but not meant to replace the worker's perception of what the weight of the load is. The classifications are light, 5 kilograms or less, moderate, 6 to 10 kilograms, heavy, 11 to 20, and also very heavy, greater than 20 kilograms. The next one is how much time do you spend on the task? So this examines the amount of time per day the worker spends conducting the task being assessed. So on average, how much time would you spend per day performing this task? So again, a job will be divided, as Melissa had said, into multiple tasks. So as a result, say someone is unloading a hand truck or something. We're going to ask them, is this less than 2 hours a day, 2 to 4, or perform more than 4 hours? The next section is maximal force level. So this refers to the maximum force exerted by one hand when performing the task. Even if the task is performed with two hands, you're asking the worker about the force for one hand only. And this measures is a measure of the forces involved that can be made by the observer to inform any intervention that may be introduced. Moreover, this measure should be used to supplement the exposure for any intervention, and again, not meant to replace the worker's perception of the amount of force. And the classifications are low, less than 1 kilogram, medium 1 to 4, or high, greater than 4. Visual demand is the next one. So you're going to ask the worker to specify if the level of visual demand of the task is low, almost no need to view for fine details, or high to view fine details. If the requirement of the task is high, you're going to want to ask for more information about what aspect of it is actually going to make the exposure high. For driving, investigates basically whole body vibration that may result from driving a vehicle at work, not driving to work, driving a vehicle at the workplace itself. Again, if the worker does not drive, do not leave the answer blank. You want to make sure that you mark M1, which is less than 1 hour or never, and then 1 to 4 hours or greater than 4 hours. Visual vibration demand inquires about the hand-arm vibration exposure that may arise from using vibratory tools. The worker is again asked to estimate the total time they would spend using vibratory tools during the working day. If the worker doesn't use tools, you're going to again select the first category, less than 1 hour a day or never, followed by either 1 to 4 or greater than 4 hours a day. Respect to work pace, you want to ask about the difficulties the workers may have in keeping up with their work. If the answer is often, ask for more information about what it is that's giving them trouble. That's going to be very important when it comes to introducing interventions later. But the 3 sections are never, sometimes, and often. Now, with respect to stress, again, you're going to ask them, how stressful do you find your job? If they answer anywhere between moderately or very, again, we're going to want to get more information because that's very important. We don't want to know why. But the 4 classifications are not at all, mildly, moderately, and very. So once we've collected all the data, got everything filled in complete, it comes down to actually time to score the variables to find out what it is where the risk factors are truly lying. And there's a number of factors, as we went through just now, that get combined into different formulas, calculations, where it's going to give us those overall exposure scores. So this is an example of the back. So it's basically there's 6 potential questions, whether it's static or moving. So for static, Melissa, if you just want to give it a quick little tap on your keyboard. There we go. We're going to add scores for static 1 to 4. Okay, and tap it again. If manual handling, and this is where the confusion comes in, it's only scores 1, 2, 3, 5, and 6. So if you had answered, no, the back isn't moving, questions 5 and 6 don't get included in the equation, whereas the static question gets removed from the equation. So this is where a lot of user error can potentially happen with respect to scoring the actual task. This is just to show basically, besides the back, any other of the questions for the scoring are very straightforward. There's no, well, if this, if that, it's just fill in the things and do the math itself. Now, once everything's complete, you're going to get a total score for each body area. That's determined by the interactions of the different exposure levels and their subsequent addition. Each exposure score for the back, shoulder, wrist, and neck have been categorized into 4 categories: low, moderate, high, or very high. Now, if low, there may be 1 or 2 interactions that may be contributing to the score that have more weighting effect on the other. For example, 2 scores of 8 compared to, for the back, for static, 2 others that are basically very low. But the effect of those 2 are going to be very large compared to the others. If the score is moderate to very high, there's likely to be several interactions that could be identified and reduced. 1 or 2 interactions may be at their highest level, 10 or 12 of exposure, and should be addressed most urgently to address breaking down and reducing the effects of those exposures. Now, the exposure scores for driving, vibration, workplace have been placed into just 3 categories: low, moderate, and high. Stress itself has a 4th category of very high. Where the scores are moderate to very high, again, that level of exposure should be the main target for reduction.
So I'm going to jump back in here. Thank you, Trevor. So this kind of led us to, where is QEC now when it comes to as far as like helping us with, computing all of these different numbers once you've done the actual checklist. So OHCOW in 2015 had an Excel version of it. It was an idea to remove that human error of the scoring. Entry required extensive knowledge regarding the code definitions and the values. There's this constant need to kind of refer back to the reference guide and then, make your selection. So you're going back and forth, which can make the task that much more cumbersome and also leave that potential to still some error. And it required us to perform the calculations and scoring. So what we've developed here is you'll see it's an Excel-based quick exposure check calculator. And this is online right now. And I'm just going to kind of walk you through what you would need to do, and then we'll do an actual example of one. So at the very top here is your assessment information. So you'll put in your name, the worker's name, the date of assessment, and the job title. Next, you'll see columns there that have task 1, 2, and 3. So depending on how if you've divided your task into different tasks, you would label them here. Maybe you just have one. Maybe you have more than 3. And if you have more than 3, you can open a second, exposure checklist to then add those tasks onto it. The information in the orange at the top is the assessor information that Trevor went through that's going to be inputted. And you can see here what we've done is that we've made these columns for each question that you're answering that Trevor just went over in detail. You are actually going to select from a drop-down menu. So when performing the task is the back, and then you would select, is it less than 20 degrees flexion, 20 to 60 degrees, or greater than 60-degree flexion. So for each of these categories, there is a drop-down menu. It's designed to be very user-friendly. And there's also physical cues. So if some of those neck movements or shoulder, wrist, or spine movements, you're not too sure what that means, there is a body segment posture help area where you can get that visual cue. And, sometimes it's easier to look at something and then be like, go back to the video. Oh, yes, they are doing this degree of neck flexion. So you can then select that at the appropriate category on the actual QEC. Then in yellow is all of the worker information that's going to be inputted. Again, this is all drop-down menus as well, just to take the air out of it. And what it's going to do is it's going to calculate everything for you. We also improved on the color coding. It was all these different hues of orange before, which didn't really, kind of indicate what's bad. And typically, that red color is a good one to choose to be like, it draws your attention to something that, duration here and weight are an issue for the back. And so I'm going to tackle that one first so that we change the colors on the levels of risk, going from white to none to very high being red. So again, too, I mentioned the calculations are completed, all the formulas are in there. So it will, once you do all your selections of every the workers and the assessors, it's going to automatically compute that into your total back, shoulder, wrist, neck, driving, vibration, work pace, and stress exposure scores. So again, taking that human error out of it. And you have the ability to, I'm going to show you a live example within the Excel document, there is a separate sheet that has an exposure breakdown. So this is the spot that you would go to if you had, for example, on this one, it's showing a high exposure in the shoulder arm area. Well, then you can go to the breakdown of the shoulder arm and see where the highest score lies. And so when you're looking at this other table for the shoulder arm exposure on the right, you can see the highest scores are in height and weight and frequency and weight. So you would want to start there as a means of intervention with those types of exposures. So in doing a quick example here for you, I was contacted by a health and safety professional to assist in assessing the ergonomic risk factors on a produce packing line. So I decided to use the QEC to quantify that risk, and it really provides that starting place for interventions that we mentioned before that you could then run the QEC after the intervention has been complete to show how much, the exposures have been decreased. Before you start, you want to make sure that you have all your things. So you have your tape measure, your phone, your for pictures or video, your scale, your pen and paper of this, or maybe you can even have this on some type of a tablet, which would make it easy to be able to do in live and have the information right at your fingertips there. So the task that I was looking at was packing. It was actually divided into 4 separate tasks, which was feeders, inspection, packing individual containers, and packing containers into boxes and stacking. So for this example, I just, that's a lot of duties within the packing area. And I decided that I'm just going to look at the feeders. So that was the gentleman here on the left is a feeder in which he's dumping tomatoes into a hopper. So to break that task down even more, what they do is they go and they retrieve a bin of tomatoes from a pallet. Now on this pallet, they're stacked anywhere from 7 inches to 55 inches high, which means that's a wide variety of postures you're going to see. You're going to see some at or above the shoulder reaches to get those ones at the top height of 55 inches. And you're going to see this, trunk flexion that's shown in the second picture here when they're getting them from the lower levels. From there, they would retrieve this bin, which weighed approximately 20 pounds from the pallet. They would pivot and carry it over to the hopper that you see in the third picture, lift it up, flip it over, and dump it into the hopper at 41 inches. Now, the frequency was about 1 bin every minute. Sometimes that would be a little bit more, depending. And there is approximately 50 bins on each pallet. So I'm just going to bring you to the live example here. Everyone can see this. So this is the QEC sheet. So what you would do is you're going to fill in your name here. All these are just kind of, easy to fill in here, your date, except for, the person inputting here that's liking to do capitals and not smelling correctly myself. But so you're going to put all your information here. Your job title, I'm looking at packing. And now when it comes to the task, I mentioned I'm just looking at the feeding portion of this right now. So I'm just going to put the feeder here. Again, if you had other tasks, you can put it in task 2 and task 3. And just so you know too, there is a reset button. So if you selected a bunch of different things here, we're going to go through this. I'm just kind of doing this for a sample, that if you filled this in and you're like, oh shoot, I messed up, I want to reset, I'm going to click here, and it's going to send it all back to the beginning, that nothing's filled out. I'm not going to fill that beginning part out again, but we'll go through each of the sections for the assessor and for the worker. So when performing the task, is the back less than 20 degrees flexion, 20 to 60, greater than 60? Well, we saw him bending all the way down to the lower end of the pallet. So we're going to say 60 degrees flexion because, again, you're looking at that worst case scenario within the task. Now, you could break this task down even further if you wanted to just look at him lifting it off the pallet. Like each task, the ability to kind of transform and use this tool in different ways, like it really can. You can break down tasks within tasks. So is there lifting, pushing, pulling, or carrying involved in the task? Yes, there is. And now if yes, is the movement of the back infrequent, frequent, or very frequent? I'm going to go with kind of middle of the road here with frequent after observing it. It would be helpful if you guys saw a video of it, but just knowing the steps and the different postures that were observed. So going on to shoulder and arm, when the task is performed, are the hands at or below waist height, at or about chest height, at or above shoulder height? Again, looking at worst case scenario here. So in this feeding job, we know that the hands probably could be at or above shoulder height if they were lifting at the top of the pallet there at 55 inches. Depending on how you're lifting and dumping, your hands can get to above or at shoulder height. So we're going to select that. Is the shoulder arm movement infrequent? So some intermittent, frequent, or very frequent? So we're going to say frequent with some pauses here. Is the task performed with almost straight wrist, deviated, or bent wrist? Well, the wrists are deviated and bent. You can see how they're in those handhelds and just the way that they're manipulating that bin to dump it and to carry it, that they are not in an almost straight posture. So we have deviated and bent wrist. And are there similar motion or patterns repeated? So we're going to say that there is. We'll kind of go 10 times per minute. Again, when you're watching it live, you can kind of count or look and see. And again, if you're looking at different people, this evaluation could change. So when performing this task, is the head or neck bent or twisted? Yes, occasionally it is. Now, getting into this yellow portion, we're going to fill this out on behalf of the worker right now live, but this is where the worker would jump in. So is the maximum weight handled manually for the task? So I said that there was 20 pounds is how heavy these bins are. So we're moderate here. And on average, how much time do you spend per day performing this task? This task is done for 8 hours a day, so greater than 4 hours. When performing this task was the maximum amount of force for exerted by one hand. So, the bin divided by 2, we've got 10 pounds a hand. So we're going to say here higher than 4 kilograms. And then the next few, there is nothing going on as far as there's no vibration they're exposed to. They're not required to drive at the job. So again, you don't leave these blank like Trevor mentioned. You need to select less than an hour and or never. When it comes to visual demands, so are they low? There's almost no need for fine details, or there is some need for fine details. I'm going to say low here. And is there difficulty keeping up with the pace of work? Sometimes there is on this job, depending on how quickly everybody's moving down the line. And in general, how stressful is this job? So we're going to say mildly stressful. So you can see at the end here, this is it's computing everything at the same time. It's giving you your total back exposure for moving. Again, the static is left blank because up here we answered yes to this question as far as pushing, pulling, carrying as being part of the task. So you're not going to get a score from this because it's going to require this movement is dynamic. You're getting a total score for the shoulder, the wrist, the neck, as well as those driving, vibration, work pace, and stress scores. So you can see here, just by virtue of the color coding on the side, that there's some high exposure factors within the different body segments here. Lower when we're looking at driving and vibration, and some moderate risk with work pace and stress. So along the bottom here, you see the exposure breakdown. So you go to the exposure breakdown to see where you should focus your efforts when it comes to intervention. So this exposure breakdown is going to break down each of those individual tasks, body segments, as well as driving, vibration, stress. So again, the static is going to be blank because this was a dynamic task for the back. And you can see here where all the scores that came to get your total of 40. And what you want to focus in on is where your high scores are. So you can see the high score here is back posture and duration. Your shoulder, again, arm height and duration, and then your wrist. I'm going to flip back to my presentation here. Do this. And so this is just exactly what we filled out that I went through live. But this here is showing, you have those high exposure scores, and then you're going to look at your exposure levels. So that's where we're getting those values from. And then it's all based on these risk factors. The risk factors for the back being weight, duration, frequency, posture. So all of those risk factors are combined to give this total score. But like we mentioned before, these exposures are broke down even further. So when we look at the breakdown for the exposures for the back, I showed you on the actual calculator that back posture and duration, that was our highest score. So we want to focus on there and see what can be done to help with that. So some of the recommendations that were made was to reduce the stacking height. And one way to reduce the stacking height also would be to use some type of a lift and rotating table. That way, those ones that end up very low on the ground, they can be raised up, as well as improving access to all sides of the pallet, being able to rotate it around. In a way, as far as to reduce the duration here, is like I mentioned before, the packing job in general, there's 4 positions. So why can't we then rotate this person to another position? And each position is very different than the previous one, which is very important when putting together a proper job rotation that's effective and giving those areas of the body more rest when they've fatigued. So if we could look at job rotation, that would reduce the duration at this job. If we looked at the shoulder breakdown, again, the highest score here we see is at arm height and duration. So again, some of the recommendations that I just talked about that we're going to improve the back also can improve the shoulder as well. If you reduce the stack height, if you put it on some type of lift and rotational pallet, that's going to improve not only the postures of the trunk, but improve the, the distance of the reach on the shoulders and the arms. So again, some of these recommendations that are made for one body area are very much so going to benefit another. And when we look at the wrist and hand, again, that whole aspect of duration and force. So duration keeps on coming up here. So you could look at reducing the weights of the bins. Right now they're 20 pounds. So is it possible to have them filled less? Is it possible to use smaller bins? All those different things that, could be explored with, a team of, workers, engineers, all of that to see what is feasible. Shipping, even that whole logistics, sometimes we have good ideas, but the logistics of shipping it in and out don't allow you to change container size. Again, other recommendations will improve this body area as well. So for reevaluation, there was different recommendations made on this job, but I wanted to show that even if you just looked at, looking at duration, and we want to implement that job rotation I mentioned about reducing the amount of time. Even if we just reduced it, the person only did between 2 to 4 hours now of that job. And so that's what I went in and did. I changed it from, greater than 4 hours. We're going to put in a job rotation, and now they're going to rotate every 2 hours. So maximum they're doing this job 4 hours a day. So we can see how it impacts the after score in that, we've gone now from 40 to 34. We have the exposure for the neck now that has gone to a moderate, and the other ones they've all reduced substantially. So you can just imagine that if you did something else too. So if you reduce that weight, even the rotational table, that's going to improve those scores too. So you can do that whole before and after comparison with the QEC to see where those exposure scores actually decreased. And with that, that was our introduction to the QEC that is online right now, and we would welcome any questions.
Melissa, before we get into the questions, I just have a couple little things to add.
Absolutely.
First of all, when people are downloading the spreadsheet, on the download page, it does explain that there are macros involved in the Excel spreadsheet. And there's a hyperlink there to take you to very step-by-step how to unlock the macro for a specific website or specific Excel document you've downloaded off the website. So you need to enable the macros for the tool to function properly. That's number one. Number two, in about a month, that's not going to be relevant. I saw in the chat someone asking about the formats. At the start of the day, I said I have an announcement. Well, Melissa and I just found out OHCOW was able to come up with funding to allow us to make the QEC completely web-based and app format. The estimated delivery date will be the end of next month. So by April 1st, the day of the Excel is gone. So it's going to be a temporary 1 month thing. And we're going to have a functional website and app available. So what I'm actually thinking is anyone that actually is going to take the time to download and try the QEC tool, it's a perfect opportunity to see if because Melissa and I found a lot of bugs when we were making this. So, and I'm not perfect when it comes to coding. So if there's anything you identify when you're using that tool, the opportunity to get you to help us be beta testers is huge because we've got this 1 month window. So I would love to get any feedback, anything you think we could do to improve the functionality of it, because I think it's going to be huge. One of the things we want to do is, Melissa had said with the Excel version, getting a second document open in order to add additional tasks. One option that we're going to be doing is with one click of a button, you'll be able to add multiple columns to have all the tasks available under the website or the app itself. So we've already anticipated some of the design changes that are going to be made available by having a web-based format. So now with that being said, you will notice that the post-Slido survey has popped up on the screen. Please take the time to complete that And I'm going to go back over to Andrew for any questions you have.
Okay, thanks, Trevor and Melissa. There were a number of questions that came through. One question was from Karen: would the QEC be an appropriate starting point in assessing foresters who perform tree trimming in an aerial device using multiple tools such as pruners, chainsaws, along with operating the aerial device controls frequently throughout the day?
I'm not sure I really understand the task, because I mean, are they operating a drone plus the hand tools?
No, I think when they say aerial device, I was assuming they're meaning like a lift. I could be wrong though.
Oh, I just read it's a bucket truck. Sorry,
bucket truck.
I had muted I had muted myself. Um, I think what you would want to do, I think is a good exposure checklist is a good start for any of it, whether you use it in combination of using each of those different tools to see, because I assume the posture is going to be different when using different pruning. I can't see the question. I know you mentioned different tools and equipment used, but I do think it's not going to hurt to use it at all. It'll give you that starting spot and see, where the exposures, if it's impacting one body segment more than the other, if using one tool might impact the body segment score too. So if you were saying that you should use this tool over this tool, maybe the body, like the scores, the exposure scores might show that using this tool does allow for better postures. I'm not sure if that answered your question.
Melissa? Is it possible to have a total risk level of the exposure combined altogether for each of the tasks or subtasks?
Sorry, you meaning the total of this altogether?
I think what they're meaning is a total score for all the tasks. So task 1, 2, 3.
Oh, yes.
All done.
Yep.
I mean, the only real way, I mean, correct me if I'm wrong, Melissa, but the only real way to do that would be to just try to evaluate the job in its entirety.
Yes.
But again, you're going to lose a lot of very specific, important aspects that could be where prevention could be introduced.
And again, you're going to look at the worst posture, right? So sometimes I think that there's a benefit to reducing it down to smaller tasks, just so you can, like Trevor said, you can kind of hone in on what it is about that particular task, because it might get lost when you're using the entire task as far as, well, they do reach above shoulder, or they do, just like I mentioned with even the task that I looked at, the feeding of the tomatoes, is that I could have broke that down even further and just looked at lifting it off the pallet.
There was a question regarding how this tool would feed into physical demands analysis or possibly accompany it.
Sorry, Andrew, what was the question again?
I was just asking, would this tool feed into a physical demands analysis or accompany it?
Well, that's actually really funny, because when I was running the tool and getting stuff ready, I had a PDA up and I used it to see, okay, is there any information I can actually take out of this? And at one point, I actually had a slide in here saying what could and couldn't work. And bottom line is, a PDA would give you the posture components for the assessor. So, the back posture, the arm posture. It's not going to truly give you any of the frequencies or durations, because there's always going to be factors that you would have to assume in it. So it would not be any use of that. Some sections of the worker section a PDA could be used to sort of validate their responses, such as the pace of the work, vibratory tool use, whole body vibration exposure, work pace. Those components could be used to validate, but going from a PDA itself, again, the frequency and durations are never going to be addressed. And as we've seen in just this a case study that Melissa gave us, it's actually the frequencies and durations that have the largest impact with overall interactions between the different body positions and their scores.
Great, thank you. Question: how do you account for frequencies when a task is done in bursts? Example would be intense for 15 minutes of every hour.
That's the worst case scenario that you'd be looking at. 'Cause again, everything with the QEC is taking it as the worst case scenario.
Okay, awesome. One last question. Gary asked, loves the QEC, but advised that do we view this as more of an exposure assessment or a risk assessment? And I guess Trevor and Melissa, do you find that those terms are used interchangeably?
I was just going to say it's kind of both. Yes, and I would think it's used very much interchangeably, because I know this really does it states exposure, but exposure really, we're looking at the risk there, right? And we're looking at the ergonomic risk factors, that whole duration, posture, force. And so I feel like they're used interchangeably. I would definitely, this risk assessment, exposure assessment is going to give you the different exposures that could potentially lead to a musculoskeletal disorder.
Yeah, and sort of just to back up what Melissa's saying,
Yeah.
I think a lot of the times, with the different tools and things that are out there, it's all about how it's defined at the very beginning. I mean, is it an assessment to define risk factors, or is it strictly a risk assessment? Because risk also could involve those safety factors, slip, trip, fall hazards, a lot of that. So if we're going to strict, Gary, to very strict definitions, it is an exposure assessment or an assessment of ergonomic risk factors. Any other questions, Andrew? Or
one more, I think. There's kind of a good one here. Comparing the QEC versus Rula or Reba, what are the advantages or disadvantages of each? So I guess like Trevor and Melissa, you're both very familiar with Rula or Reba. When would you use the QEC, over those two tools?
it's a great question, because honestly, I personally haven't looked at it. When I was putting everything together, I did do a quick search, and there are studies out there that did do sort of scenario based. I really don't know for sure. Do you, Melissa?
Well, I would think too, like your Reba, you're looking at your entire body. This doesn't really look at as much of like the lower limbs. I feel like when you're looking at specific postures, I feel like there's more detail in the Rula or Reba compared to this. Again, I've never compared them. It would be interesting to see how they would compare side by side using this same tool and, Rula or Reba, for example, the task that I did. And if it would just, both of the tools give you that, there's that whole idea of, is further investigation needed or changes need to be made? And that's kind of what this is doing too, is it's highlighting those areas where changes need to be looked at to be made to reduce that overall risk, which is what Reba and Rula are doing as well. But it would be interesting to see if they would align. I would assume that there would be, it would align fairly similar to them. But yeah, good question.
And no, that may be a topic for David for next year. I mean, last week he did Reba versus Rula. Maybe now it's going to be Reba versus Rula versus QSC or QEC.
Absolutely.
So I think that sums up all of the questions. Again, if there's anything that we missed, please feel free to send us an email. I'll put the email address in the chat here. And thanks.
Okay, well, great. Thank you, Andrew. Thank you, Melissa. Thank you, Dwayne and Joe. Again, please take the time to fill in the Slido survey. And just to give you a few other little housekeeping details before everyone signs off. Again, thank you for joining us this year. It's been great, and I've really enjoyed a lot of the sessions that we were able to bring to you. At the same time, I will be uploading the last 2 weeks' recordings onto YouTube. And at that point, you will be getting an email to an overall evaluation of this year's event. That, again, your feedback's very important. It's invaluable, as well as asking you, what topics we want to see for next year. And at the same time, you'll also be on an update list for when we get the web-based QEC tools and the app-based QEC tool up and running. So with that, I just want to again say thank you to everyone. And I hope you all have a great weekend and stay safe.
Thank you, Trevor, again, as Dwayne mentioned at the beginning, for all your leadership this month and for the past 26 years for this event. And there was a question about posting the chat, so I think we can look into that. We do have the chat saved in WebEx, so we could potentially post those too. Someone has a hand up. Mary, do you want to unmute, or we'd have to?
My name is David Boros. I just wanted to ask, how does QEC count for shift lengths? So, for example, if the factory has a 12-hour shift instead of an 8-hour, or is it a night shift instead of a day shift? Can it compare it, or should I use a fatigue assessment combined with the QEC?
David, I'm not actually sure. I'd have to go back and review the reference material.
Oh, okay.
Yeah, I mean, I'm not sure if you have my email, but if not, I'll post it in the
If you
chat
could post
because,
it to the chat, yeah,
yeah,
that would be great.
and then you can just fire me off an email and I'll have a look into it for you because that's actually a great question. And, again, it's something we see with almost every tool out there, even a lot of sort of PDD templates is they only look at 8 hours. They don't adjust
Yeah,
for
yeah, and
12-hour shifts. So yeah,
back in the day, the Toyota method used to look for a shift length and frequency of desk repetition, and nobody uses Toyota anymore, or at least I don't know anyone.
I know. Again, good question. And yeah, send me off an email and we'll definitely look
I
into it
will.
for you.
Definitely
Okay.
will. Thank you.
Okay, perfect.
Great. Thanks, everybody. The whole Ergo team and Tony too.
Thanks.
See you next year.